We're going to continue talking about renal physiology, and we're going to focus primarily on the capillary system within the kidneys. And if we see here, the capillary system is considered the glomerulus, and that's contained within the Bowman's capsule. And from a conceptual standpoint, the function of the glomerulus is to create an ultrafiltrate from the plasma that's entering into the Bowman's capsule, and through a process of filtration, there's a production of ultrafiltrate which contains many different electrolytes. For example, sodium, chloride, phosphate, and certain constituents such as amino acids, glucose. And we can see that this takes place through a filtration process within the glomerulus. And we can see here that the glomerular filtration pressure, the pressure that's generated within this filtration system, is determined by the glomerular capillary pressure and the glomerular oncotic pressure. And these two major determinants, along with the renal interstitial pressure, determine the overall glomerular filtration pressure. So we can say the first determinant, being the glomerular capillary pressure, is approximately 60% of the mean arterial pressure. And if we were to assume the mean arterial pressure being somewhere close to 93 millimeters of mercury, 60% of that is approximately 60 millimeters of mercury worth of pressure. And that's your glomerular capillary pressure. That's the pressure that's being generated. And the opposing forces or opposing pressures are the plasma oncotic pressure, and that's the pressure that's pulling the blood back into the capillary system because of the concentration, for example, the proteins within the vessels of the capillary draws the blood back into the capillary system. Likewise, the renal interstitial pressure has a pushing force that tries to push the blood back into the capillary system or prevents the blood from flowing from the capillary system into the proximal convoluted tubule. So you can look at it conceptually as the glomerular capillary pressure being around 60 millimeters worth of pressure, and the two opposing forces being the plasma oncotic pressure and the renal interstitial pressure being 25 and 10 millimeters of mercury respectively. So therefore you can say the overall glomerular filtration pressure equaling 60 minus the 35, and therefore being approximately a forward flow generated by a pressure of approximately 25 millimeters of mercury worth of filtration pressure. Now these pressures and the forward flow within the capillary system can also be influenced by the tone. And here we can see that you have an afferent arteriole, which is the blood supply entering into the capillary system, and you have an efferent arteriole, which is the blood flow that's exiting the capillary system. And you can see here the glomerular filtration pressure, which we just discussed, has an inversely proportional relationship to the afferent tone. So the tone within the afferent arteriole system has an inverse proportional relationship to the overall glomerular filtration pressure, and hence and ultimately the glomerular filtration rate will be involved. So for example, if you had vasoconstriction or increased tone in the afferent arteriole, for example through the sympathetic tone, or perhaps even the angiotensin II has a direct vasoconstricting effect, that increases the tone of the afferent arteriole, and therefore the result would be a decrease in the glomerular filtration pressure and ultimately a decrease in the glomerular filtration rate. And on the contrary, if you had a decrease in afferent arterial tone, this would increase your glomerular filtration pressure and therefore increase your GFR. And if you were to look at the efferent arteriole, you can say that they have a direct proportional relationship. The glomerular filtration pressure has a direct proportional relationship to the efferent arterial tone. So therefore, if you have an increased tone, vasoconstriction of the efferent arteriole, this would increase your glomerular filtration pressure and hence increase your glomerular filtration rate, your GFR. Next, we can look at the more detailed structure of the Bowman's capsule. And you can see this is the endothelium within the capillary system. And this is the lumen, which basically contains the plasma and all the different electrolytes, the constituents such as protein, glucose, and certain cations and anions. And this passes through the fenestrated gaps within the endothelium of the capillary. And through the glomerular filtration pressure, which we talked about here, the glomerular filtration of approximately 25 millimeters of mercury worth of pressure generates the forward flow, pass through the endothelium fenestrated gaps, passes through the basement membrane, which is made up of the lamina rara and the lamina densa, and then passes through the foot processes of the epithelial cells within the Bowman's capsule. And this is what causes or what creates the filtration of the ultrafiltrate of the plasma. And this is all the constituents that's going to be entering into the proximal convoluted tubules, which we'll discuss in the next lectures. All these elements have passed through the Bowman's capsule through that filtration process to create this ultrafiltrate of electrolytes, cations, anions, certain constituents such as glucose and amino acids. And we'll talk about the whole series of reabsorption and secretion as this ultrafiltrate passes through the various portions of the nephron. The glomerular filtration rate, on average, is approximately 20% of the renal plasma flow. And we can say 20% of the 660 mLs, which we calculated before, is approximately 132 mLs per minute. And we can say as a generalization, the normal GFR for a male is approximately 120 mLs of blood per minute, plus or minus 25 mLs per minute. Likewise, the normal GFR for a female is approximately 95 mLs of blood per minute, plus or minus 20 mLs. And you can say that approximately 120 mLs of blood per minute is passing through the glomerulus. The glomerular filtration rate of all this fluid that's passing through these filtration process to create the ultrafiltrate is a GFR. And we'll see how in differing lectures when there's pathology within the glomerulus, for example through hypertensive glomerular nephropathy or any type of nephropathy that's involving the glomerulus, for example from diabetes, a patient may go into either acute renal failure or chronic renal failure to ultimately end-stage renal disease when this is no longer working adequately to create an ultrafiltrate and eventually to create the excretion of urine containing all the toxins and metabolites. So therefore, we'll talk later in detail about renal patients and perioperative management of renal patients. The next lecture will focus more on the proximal convoluted tubule, and we'll talk about the whole dynamics that takes place in order for the proximal convoluted tubule to reabsorb the ultrafiltrate back into the capillary system and the series of secretion of certain elements from the capillary system into the lumen of the proximal tubule, which will eventually be excreted outside via the urine.